built on slab. Well, that actually is a selling point. Down the road, it'll benefit the maybe 10 years from now. Rick Farrell, the general manager of HYI, should be here shortly, and we're very proud of it. One of the important things to note is how long it takes to build these buildings. This one will open in probably the late fall of 2021, just down here. And I also wanted to thank Crystal Ray, the Committee for an Age-Friendly Markham. Crystal invited me to participate about a year ago, I think it was a year ago, January, and I was very pleased to do so. I've been frustrated as a councillor about two things. The lack of progress on, one, the price and availability of land for affordable housing. We have not been able to get enough affordable housing, and the price and availability is one of the major issues. We're going to address that today for seniors and others. And the second is the lack of progress on dealing with the oncoming numbers of seniors with health issues. Eventually, we all have health issues. I'm a senior myself, and my knees are starting to tell me they don't want to go upstairs all the time. And the baby boomers are coming at us, a huge onslaught of baby boomers. And I'm not sure our community of Markham, I'm not sure York Region or Canada is ready to deal with the large number of baby boomers who are coming, who will start having health issues. So I'm going to turn over the meeting to my co-chair, Andy Langer, at this press conference, and he's going to introduce our recommendations.
Good morning, and thank you all for coming. And Markham has been meeting for over the last year to develop recommendations on improving senior services and life for seniors living in Markham and in York Region today. Our committee consists of 4 people. Gail Lee, a longtime Markham resident, who's also chair of the Markham Seniors Advisory Committee. Gail, wave. Thank you. Crystal Ray.
I didn't see her wave.
Well, everybody knows who Gail is. Crystal Ray, sitting right on the outside, is a longtime resident and advocate in Unionville, and I might say personally a heck of a gardener. That's how we originally met. Diane Gabay, who is also on the Seniors Advisory Committee, and myself, Andy Langer, just a more recent Markham resident. I've lived here in the last 5 years. I'm really enjoying the experience. So who are we? We're 4 local Markham residents who are concerned with the impending onslaught of baby boomers in Markham and York Region. We're concerned with how the community is preparing for this emerging issue. We've been working closely with Jack Heath, former Deputy Mayor and now Regional Councillor, who shares our concerns. He and his assistants, both Melissa Key and Melinda Fong, have assisted us to formulate our collective ideas into a comprehensive package for presentation to you today, and ultimately we hope to Markham Council in the near future. Our initial concerns when we formed about a year ago were threefold. One, we were concerned about the lack of oversight on personal support workers and the organizations that provide personal support workers to people's residences. Secondly, we were concerned about the dramatic gap in affordable housing for seniors between the expressed needs in the community and what is both currently available and planned. And thirdly, the lack of any residential hospice facilities in Markham. Let me just give you a few background statistics. In 2016, the population of Markham was just over 329,000 people, of whom 21.7% were over the age of 60.
27.
No, 21.7.
21. That's a new one.
By 2031, Markham's population is expected to grow to just over 422,000, with 118,000 of those people over the age of 60. That's a 66% increase in the senior population. 47,000 new seniors added here in the city of Markham. Currently, well, let's talk about big picture first. In 2017, there were over 14,000 households of all ages on the York Region Affordable Accommodations waitlist. That was an increase of over 3,000 over the prior year. Every year, there are more people being added to the wait list than units being built. The problem is getting worse every day. Here in Markham, of that wait list, 6,385 senior households are looking for accommodation on that affordable wait list. That's over 74% of the households on the affordable accommodation wait list here in Markham. We've invited you here today to join us while we present our 19 recommendations. They're comprehensive, they're concrete, and they're recommendations for action. In the interest of time, we're going to be addressing 11 of them across our panel, and the balance are available in the printed materials that's been handed out. Action is required at the municipal level, both the city and the regional level, and the provincial level. A number of these recommendations touch more than one level of government and may require a coordinated approach to implementation. Many people might see that as an impediment to progress. We see it differently. We believe the resources are in place today to move forward. With intelligent changes to current policies and practices, and by working in concert with private industry, especially the housing development community among others, we believe that many of the issues we've identified can be addressed quickly and at minimal or no cost. Given the magnitude of the change required and the urgency of a rapidly changing demographic, we believe the time for action is now. I'd like to turn the floor over to Jack Heath to present the first recommendation.
I'll get into it right now. Most seniors want to live independently as long as possible. Bungalows are the most senior-friendly, ground-based type of housing for seniors. For those with mobility issues in their own home, the only option today is a bungalow or a condo apartment, a bungalow in the sky. Because of the price of land, we no longer build the number of ground-based bungalows needed. Markham's current flavor is for townhouses with 3 or 4 or 5 stories, 5 floors. Not senior-friendly. I can guarantee they're not senior-friendly. We need a significant number of homes that are more accommodating, less demanding as people age. As your mobility reduces because of knees and other issues, stairs are an impediment to living at home. We all benefit. If people can live at home longer, but have fewer falls, they will have less need for and financial impact on the ever-rising cost of long-term care and hospitals. So our first recommendation is for always homes. It is recommended that future single, semi, and townhome developments approved in Markham contain a minimum portion of always homes, those which allow owners the option of aging longer in their own home. An always home is one with no impediments for people with accessibility or health issues, which may require them to live on the ground floor of their home now or a later point in their lives. Our proposal is that there be 10% of new home developments be always homes and built on grade with no basement, thus ensuring greater affordability. That 10% of new homes developments be always homes and built on grade with a full basement, and that 10% of new multi-residential units being developed meet the always home guidelines as well. As to recommendation number 2, simple design modifications can be adopted to improve the ability to age at home. Homes can be made safer for seniors, less stressful, and more adaptable to the steps that occur as we age. Advanced developers are already implementing these designs, and remember, some of them apply to condo units too. So here's the recommendation. Always guidelines. It is recommended that the city develop standards for always homes and units for implementation as soon as possible in all new developments, having consideration for such matters as wheelchair accessibility, including hallway widths, better kitchen and bathroom design, a shower on the main floor, proper door handles, a location for short-term sleeping quarters on the main floor, no steps from grade up to the front door and to the main floor inside, and railing and ramp locations for future installation if required. Now I'd like to turn it over to Diane.
There's 2 recommendations that would allow seniors to remain in their homes longer. The first one deals with new builds, and the second with existing homes. I return to the point that few bungalows are being built anymore, and the ability to get around multi-level homes as person develops health issues is extremely important in keeping people in their homes longer. All we are talking here are small design improvements. So the first recommendation, home elevators and chair lifts for new homes. It is recommended that to improve mobility for seniors and others within their own homes, thus allowing them to remain in them longer, that the city require that all new singles, semis, and townhouses being built in Markham include space and structural support for future installation of home elevators and or chairlifts if needed. As for the next recommendation regarding existing homes, we have a huge inventory of them. In fact, currently, there are about 75,000 homes in Markham, and most of them, with reasonable expenditure, could be made to accommodate seniors with changing mobility needs. This would be far more effective, cost-effective, than constructing new long-term care facilities. Most seniors in our community would like to continue to live in their own homes as long as possible. We believe that the capital cost could be in the $25,000 to $50,000 range for home elevators and well below half of that for chair lifts, but we need more information. So to that effect, for recommendation number 4, for home elevators and chairlift for existing homes, it is recommended that to improve mobility for seniors and others within their own homes, for those living in the city's existing homes, that Markham and the York region conduct a pilot to retrofit home elevators and chairlifts program for different types of existing homes to determine the best way to retrofit them. The expectation is that the recommendations at the end of the pilot will transition into significant improvements in current programs. And now I'd like to pass this on to Gail.
My name is Gail Leet, and I'm here to present recommendations 5 and 6 to you. For the past 4 years, I've spent much time in hospital, have assumed the role of a caregiver, hired and explored the world of personal support worker, and encountered the loss of a loved one. The palliative care provided for this end-of-life patient lacked either compassion or thoughtfulness. These are my reasons for my involvement in these 2 initiatives. Home care is going to be even more important in the future, as huge number of baby boomers come on scene. We need better regulation, training, and financial support. Recommendation number 5, nursing and personal support services. It is recommended that York Region and the province dramatically ramp up at-home care for both nursing and personal support services, including corporate and individual registration and qualifications, training, financial assistance, etc., in order to encourage seniors needing lower levels of care to remain in their homes longer before being required to transfer to a facility with higher levels of care. Regarding the topic of residential hospices, Markham is the 6th largest city in Ontario and the only one in the top 17 that does not have a residential hospice. Markham is the only city in Ontario with a population over 300,000 without one. Based on current Ministry of Health and long-term care guidelines, the city should have a minimum of 23 residential hospice beds, increasing to 30 or more by 2031 to serve the projected population growth. Current best practices in Ontario suggest a size of approximately 10 beds. Residential hospice is widely recognized to be a more cost-effective delivery manner for end-of-life care, especially compared to hospitals. The ministry acknowledges that they save an average of $630 per bed per day compared with dying in a hospital, which represents a minimum annual savings of $5.3 million. Recommendation number 6, hospice. It is recommended that in order to meet the need for palliative end-of-life services in Markham, the city support the establishment of 2 to 4 residential hospices over the next 12 years with a target of 30 or more independent hospice beds. Provide the land at little or no cost for the first hospice site, and endorse the first hospice for 10 or more beds being built as quickly as possible. Now back to Jack for the recommendations.
The deputy mayor has arrived. Recommendation number 7, and this is about land costs. Land costs is estimated to be up to $6 million an acre in Markham, make affordable housing difficult, if not impossible, to deliver. Indeed, one of the issues of the affordable housing crisis is the lack of low-priced land. We believe that there will be ample supplies of land for affordable housing if Markham follows these recommendations. So recommendation number 7, the supply of land. It is recommended that, since the cost and availability of land are the largest impediments to significantly increasing the supply of affordable housing for seniors and others, the city obtain land presently being used for surface parking at no cost for the purpose of building affordable townhouses, condo apartments, and purpose-built rentals. In order to replace the lost parking, the new housing development would provide the former owner an equal number of underground and/or structured parking spaces within the new development at no cost. The largest parking lots that fit this category can be found at public utility companies, school boards, hospitals, public transportation agencies, governments at all levels, and possibly places of worship. Recommendation number 8, especially for seniors, locating living spaces close to important amenities is especially useful. This will also help with reducing loneliness, which is being recognized and has been recognized as an increasingly important issue to address for good mental health. So the exact recommendation is on preferable locations, and then Andy, you're going to get up. It is recommended that the city, in order to reduce the requirement for an automobile, concentrate on finding location opportunities for recommendation 7 near good transit, important services such as medical and dental, and amenities such as grocery stores, pharmacies, and other retail. Now you can get up and get it, Andy. When we apply the opportunities listed in number 7 and the criteria in this section, number 8, we find there are numerous locations in Markham which may fit the bill. Melinda, my assistant, was going to, but Andy's got it now. Here is the map of the city of Markham with 9 potential locations. You can see them around the hospital, around community centers, around City Hall, and in other city-owned land and locations across the city. Now, we're no experts. None of us here are experts on this. We know that the city staff, when we give this to city staff, will research and say this one won't work, but you forgot these other 2. But we've come up with, in our independent look at it, with 9 possible locations. I'll next turn it over to Andy.
Thank you, Surplus school board lands are currently sold at market value. These sites are often well located for affordable housing, making these properties available to municipal governments or agencies, if they're going to be used for that purpose, at basically the original cost, will increase the inventory of land available for affordable housing. So recommendation number 10, surplus school property. It is recommended that the province, in order to reduce the price of land and increase its availability for affordable housing for seniors and others, introduce a requirement that the sale of surplus school board property to municipal governments or agencies, if for affordable housing purposes, be at the value of the original land purchase plus carrying costs as opposed to part of market value. Now I'm going to turn the floor over to Crystal for the next 2 recommendations.
The need for affordable housing for seniors is urgent. We're offering 2 suggestions, namely secondary suites and coach houses. The secondary suites, it's important to note that currently there are estimated to be over 7,000 illegal secondary suites in Markham. Converting these to legal accommodations would improve conformity to fire safety regulations, building codes, and electrical codes. Legalizing them means improving the quality of living and safety for seniors. Markham has twice turned this down, and we believe that the 3rd opportunity will be charmed. On secondary suites, it is recommended that the city, in order to maintain and provide housing options for a larger range of residents, should firstly permit secondary suites by right across the city, legalize all secondary suites in the municipality which meet the parking requirements, and establish a 5-year program to register them, thus ensuring that those already in existence meet safety and reasonable living standards as set out in the fire and building codes, and develop a program to encourage the provision of more secondary suites in the future. Size has a relationship to affordability for both the purchasing and rental of housing. We think the city should spend more time ensuring that there is a good supply of smaller housing. Secondary suites are part of the solution, and so are others like coach houses, for instance. It is recommended that the city encourage the building within the current urban boundary and in the future urban area of significantly increased number of smaller homes such as coach houses, which are defined as homes above garages not attached to the main house, in order to provide greater opportunities for affordable rentals and purchases for seniors and others. Now back to Andy.
Thank you, Crystal. 19 recommendations. The balance are available in the printed materials that we have available for you, and I see most of you reading along, so thank you. That's great. If you didn't get one, I believe Melinda has extra copies. Our final recommendation deals with how to move forward with a degree of urgency. I talked about how quickly the number of seniors here in Markham is going to increase. This is an urgent matter. Recommendation number 19, the last one on your printed materials, deals with process. It is recommended that these 19 recommendations for an age-friendly Markham be presented to Development Services Committee and then sent to staff for public and stakeholder input, with a draft report coming back to DSC by June 2019, and that staff in Markham and York Region also give consideration to developing further incentive programs, if required, to accomplish these recommendations. So in closing, you've been quite patient, and thank you for listening to our recommendations. We believe these would position Markham in a leadership role for an age-friendly community. Much has been done globally to study and move forward with these ideas and others. We look forward to the opportunity of working with governments and private enterprise to make these recommendations come to life and improve the quality of life of residents in Markham. We invite your questions, recognizing that we're not experts in these fields. The next step is to have appropriate staff review and prepare action plans as appropriate to support the adoption of these recommendations in a practical manner. Again, thank you all for coming this morning. We look forward to any questions and comments you may have.
I think he dealt with number 7. Could you explain a little bit more about the supply of land? Because that's fundamental to what you're talking about. You don't have the land, you can't do anything.
Right.
So can you give a little bit more explanation about number 7, the supply of land? You're talking about public utility companies, school boards, hospitals, etc., and possibly places of worship. So what do you got in mind for us to look at as a council to help you with this
Let me
land?
give you an example. All the time I've been a councillor, the parking issues at Thornhill Community Centre have been serious. I would say that at this very moment I have no idea what's going on at Thornhill Community Centre at the moment, but they probably only have 30 spots left at this moment, let alone in the evening when there's a hockey game on, all sorts of things. What this proposal would do is say to the City of Markham, the city owns it anyways, we're going to build some affordable housing for seniors, for example, on the parking lot somewhere. And we will take the parking spots removed and build a floor or 2, or maybe even 3, under the building, either underground or in structured parking, the first 2 floors or so, to provide for the parking that Markham has just lost. And we'll have I don't know, I have no idea, there's no plan. Above that will be the seniors' houses. And so what you've done is ensure that Thornhill maybe even gets more parking, the community center, and at the same time, there's no cost for the land. I tested that on a couple developers to say, is that a reasonable trade for the cost of land if we build structured parking? They all said, 2 of them said, it's a go. You've reduced the cost of land, which is the major component of affordable housing, to 0. And taking on 1 or 2 levels of parking is nowhere near the cost of land. So that's a good example, I think, of how it would work. And there are many others. I've flown over Markham a couple times. I remember got a $25 flight over at Buttonville. And there's two things that jump out at you. One of them is the number of swimming pools in the backyards, which is not in my backyard, but I was stunned with them. The other is the amount of surface parking in the city of Markham. The biggest parking lot I can imagine in the city is around Markville, but that's privately owned. The second biggest is around the hospital. And the hospital doesn't want to build structured parking. It can be expensive. So you turn around and say, well, maybe we can find a way to get you at least the same or not more parking, and we can also use the land for affordable housing. That's how it works.
Okay, thank you.
Recommendations here, and that's an awful lot of recommendations to, if realistically, to get through. If you had a list of 3 or 4 that you held really close to your heart, all of you on the committee, what would the 3 or 4 be that you would really love to see get through?
So, yeah,
You-
a very difficult question to answer. Maybe I'll start with the last recommendation. These are very sound ideas in our view. We've tested them out in the community with private developers, with others. The most important one is recommendation 19. Go ahead, please put some flesh on the bones of what we've presented and come back to us in short order with recommendations that can make these concrete and real. Beyond that, the reason we've prepared 19 recommendations is it is a comprehensive package. There are very few here that can be separated out and stand on their own. There are 1 or 2, I'm not going to talk about those. But it's a comprehensive package, and we think it needs to move forward as a package to staff and come back with the appropriate implementation steps that get those implemented quickly.
So you're not willing to...
No, I'm not going to tell you which baby is the cutest.
Some are more important than
Yeah.
others?
Yeah, they're all incredibly important. In my mind, there's no cuter baby, or there's nothing that needs to move ahead more quickly. I think it's fair to say that some could be separated, but we see them as a package.
How likely do you think it is that the province is going to come aboard and support some of these recommendations, knowing how difficult the province has been to deal with the municipalities?
It's a great question. You're asking the wrong person. The answer is we haven't tested it extensively with the provincial government. We believe there are quite a number of things here that can operate independently of the province cooperating, and we think that with appropriate consultation that we can bring them on board because they're logical and they're cost effective. And we're not looking to spend money in addition to what's being spent now. We're looking for reallocation of existing funds.
I would add that there aren't too many costs involved in all of this. As to the province, their biggest cost, 50%, healthcare. What we're talking about is, can we find ways to keep seniors in their homes longer? Can we find ways that maybe there can be better care for the senior who stays at their home than there is now? Maybe some support. Because if the senior has to go to the hospital and stays there because there's no hospice, no palliative care locations elsewhere, or they could have got the same help at home, the cost is much, much, much lower. It'll save money for the provincial government. The only one that requires a provincial initiative that they would have to think about would be about saying, what's the price of school board land when they decided to move the school to some other newer location, what have you. And they would say, well, potentially the school needs the money to build the new school. Maybe that's true. Not always, though. Sometimes the Catholic Board is reducing its school total completely. There's fewer schools, if you know what I mean. So selling it for affordable housing at the cost that they paid for the land 30 years ago, plus maybe carrying costs and things like that, would allow, as long as it's promised to be for affordable housing, seniors housing, would allow us to get on with building some. I commend Councillor Ray and her ward. There's one similar situation in her ward, my ward, where I live. And the cost of the land was very high, mainly because it was at current market value, rather than the $200,000 or who knows whatever it was paid per acre 25 years ago. And that is the only issue that the province might have to think carefully about. All the rest, it'll save the money.
I wonder why the school board, if it's got surplus land, would be willing to sell at 30-year old prices when
Oh,
it
they
could
wouldn't.
get current market value.
The recommendation for the province to tell them that we need affordable housing. We need to house seniors and others, and that's so important that we need the affordable land. And that land is right in the heart of the city. And shifting, numbers of students going somewhere else, or maybe not even living in Markham anymore, means that there's a profit there to be made that goes straight to a big reserve. And okay, maybe you don't want affordable housing, but don't deny that that's one of the ways that could be done to provide affordable housing.
Right.
My question is that if this is the issue for Markham, it could be the issues for your region too. Will you send it to the your region? Maybe you do it the whole region instead of just one city.
Sure. Yes, the answer is absolutely. The issues go well beyond the city of Markham, and they're being mirrored in community after community here in Ontario. We want to deal first with what's closest to us. We believe we have a council here that's open to hearing about these issues, and we believe we can press them here. It will require cooperation from the region of York, and there will be other communities in York that should be taking on some of these ideas and making them their own. We're not looking to do something here that can't be replicated. To the extent that these can be moved forward in other communities, we're totally in favor